I want to bring in Jamie, who has done some very sterling research on the obfuscations, Jamie, according to you, that we saw from China in the first wave, the lack of honesty with the world that could have led to a very different outcome for the rest of the world. Now, here's the question. Given China's dodgy track record on being transparent with its data, given the fact that their official counts are still not reflecting the kind of catastrophe that Eric and others have spoken of, should the world be looking at shutting borders, air traffic with China? I ask this even though I'm not a fan of this approach. When this happened with South Africa, I criticized it. But China has a record of an absence of transparency. Jamie, how are you looking at what's happening?
So thank you, Barkha, and I'm happy to be here with you. So let's break that down into the two parts of your question. First, what are the implications of China's lies, not just for China, but for the rest of the world? And second, how should we respond? So already in the earliest days of the pandemic, China's lying and obfuscation, including lying to the World Health Organization, lying about what was happening there, not giving the rest of the world the information that we would have needed to respond more aggressively in the early days of the pandemic, which is separate from the other question that we've talked about in the past. How did the pandemic even start in the first place? But that round of lies put the rest of the world at risk. Right now, there is absolutely no doubt that the Chinese government is lying on an industrial scale. Yesterday, they announced that there were 5 and then 7 total deaths. We're all seeing these images of people lined up, cars lined up around the block in crematoria. The numbers, China has stopped recording the spread of COVID inside of China and is just lying again on an industrial scale to the Chinese people and the world. That's not just bad for China, it puts the rest of us at risk. We all need eyes and ears everywhere, because one of the things that the pandemic experience has taught us is that a threat anywhere is a threat everywhere. And so what we're going to see, I certainly agree with Eric that we're going to see these big numbers, and there are going to be lots and lots of deaths, lots and lots of exposures. And because of lots and lots of exposures, there is going to be a lot of variation in and mutation in the virus. And if we don't have eyes and ears on the ground in China letting us know what we're facing, then we are all at risk. And so, I'm like you, Barkha, I'm cautious about blanket travel bans, but we need to be looking at everything. And at the same time, what we need to be doing is helping the Chinese people. The Chinese people
Well, they have to be willing. They have to be willing to seek that help, right? China so far has not been willing, for example, to import Western-made vaccines, or even India-made vaccines, dare I say. JB, I'll get to that in a moment, but you had a statement. The Chinese government is lying to its people and therefore to the world on an industrial scale. Can you give the most stark example of this industrial scale lie that you've witnessed perhaps in the last week?
Yeah, well, like I said, they have said there are 7 deaths from COVID. We are looking at the images that you just showed of these bodies lined up. They are saying that, I don't know what the exact number is, but 7,000 infections. That's a lie. Even the idea, the World Health Organization, Mike Ryan announced last week that this explosion was already happening before the protests. So they're having the protests inside of China. So China has already been experiencing exponential growth of infections. And then on top of that, the government, which had before been saying, oh, we need to be worried about COVID, and China is responding with zero COVID better than the rest of the world. Now the Chinese government immediately is saying there's really no threat from COVID. It's mild. Everyone should go to work, even if you have mild symptoms. And what they seem to be doing is using this tool of propaganda in a way to try to propagate the virus, to get through a massive explosion in infections as quickly as possible. And Eric mentioned 1 to 2 million deaths, The Chinese government, the Chinese Communist Party, is in the business of lying about the deaths of the Chinese people. It's estimated that
Yeah.
about 47 million people died as a result of Mao's policies, and yet that is swept under the carpet. And what they're going to try to do is sweep this under the carpet, but that puts all of us at risk.
Vineeta, how do you look at what's happening in China, and how should we and the rest of the world be responding?
In addition to what you said, I agree with you when you presented statistics about vaccination status in India. But what you have completely excluded, possibly because we also don't have data, is 0 to 12 age group. There are some vaccines which are now recommended for zero, not zero, but say 8 to 12 or some such age group, so that younger generation can also be covered and somewhat protected. For that, I have no idea what the data are like, what the numbers are like. So that's an additional chunk of vaccination which is missing from the scene that you described. So yes, vaccination would be useful. I also think that other people have been saying, other countries who are good in epidemiology and serology have been saying that 60%, 70%, 80% positivity after the Omicron. So whatever earlier wave followed by Omicron, so in total infected people were close to 80% in some situations. We have data on some metros, some small data on here and there, but we are also a very big country. I mean, like China. So we don't have good data. How many of us were actually infected with Omicron? We have no idea, because also the major lacuna right now is that if we assume that China is going to be the source of spreading one subgroup, second subgroup, one variant, second variant, I don't know what, because I haven't come across real sequences of which virus variant is currently prevalent in China. If
Yeah.
we know that, and if it is closer to Omicron, and if I know I'm adding many ifs, and if the at least 60% of the Indian population, young and old, vulnerable, non-vulnerable, are or were infected by Omicron, then we might not have so much of risk, because Omicron was just less than a year away. So December, January was when Omicron hit India very badly, and it has been continuing to some extent. So in that sense, the risk is less, not because possibly we have good coverage of vaccine, because you also have to remember that the vaccine that we have had is the Wuhan strain, and Omicron infection is actually, so infection with Omicron and whatever minor consequences are not really covered by the original Wuhan strain, though now there are some vaccines which might become available.